Well, a warm welcome to this weekend update. It's Saturday the 25th of September in the evening. Now, I want to look at vaccine hesitancy today in the UK, but I want to do a bit of a global update first of all because I just felt a bit out of touch with what's going on because things do move quite quickly. So let's start off with a bit of orientation here. Now, this is the new daily cases. So United Kingdom, United States, Canada, South Africa, India. Now, cases still going up slightly in the UK. This is a definite decline now in the United States. Pretty good news. Canada level. South Africa going down. And of course, South Africa heading into their spring now. So things could get better there, although vaccination rate is not brilliant. India cases remain low, which is very encouraging in India. In terms of deaths, well, United States, I'm afraid, deaths are still high. There's going to be a lag. They will go down pretty soon, but at the moment it's still high in the States. Moving on down, this is South Africa here. So that's encouraging drop off in South Africa in terms of deaths. United Kingdom still going up slowly, to be fair there. Canada pretty well, probably slightly going up there. And India remains reasonably low in terms of deaths per million people. Now, patients actually in hospital now in the United States, this is dropping off really quite nicely. Now, it's still high. This is still high. There's still a lot of people in hospital in the States. There's still a lot of pressure, but the trend is looking good, even although the trend in deaths is still pretty upward in the States and might be for another week or two. Moving on to the United Kingdom, where we're going down slightly. Canada still going up in terms of hospitalisations. So that's the hospitalisation situation, or the people actually in hospital. And in terms of vaccination, well, Canada now leading the way, then the United Kingdom. European countries tend to be round about where Canada is. Ireland and Spain, for example, slightly better than the United Kingdom. United States, in terms of people fully vaccinated, well, still relatively low considering the amount of vaccines that are available. India and South Africa, well, really quite low levels of vaccination in terms of percentage of the population. So I just thought that was useful orientation. Now, in terms of global vaccination, it's an interesting picture. We might actually have a graphic of that. Have we got a graphic of that somewhere? I think we might have. Yeah, there we go. I'll show you that in just a second. But let's just look at some figures first of all. Global vaccination. 44% of the world's population has received one dose of a COVID vaccine. So 44% of the world's population. I mean, this is starting to look like pretty impressive figures given the amount of time that there's been. 6.1 billion doses have been given out. At the moment, the world is giving out nearly 30 million doses per day, 29.41 million doses per day. 2.2% of people in low-income countries have received at least one dose. So, well, there we go. I mean, 44% of the world's population, lower-income countries, 2.2%. And this is this graphic I wanted to find for you, which we now have here. And this shows this really quite poignantly. So rich countries, United Arab Emirates, Spain, a European country, of course. China has been vaccinating really, really rapidly lately. They've started a bit late, but they're certainly catching up. Although there is a quite a concerning lack of data from India, really. From China. We're not really sure about vaccine efficacy, but it is going rapidly. So next we have Canada. So we actually see that Europe's slightly above Canada, which is interesting. Then the United Kingdom, then Brazil, India. That's the world average just there. 32% with one dose, 12% with two doses, about 44%, as we've said, altogether. Russia not doing very well, major trust issues in Russia. Then South Africa with great challenges in terms of dose availability. Bangladesh, low. Then Ethiopia, Nigeria, Tanzania. So if we look at some of these poorer countries compared to some of the richer countries, I think that pretty well speaks for itself. People that can afford to buy the vaccines are getting them. people that can't afford to buy the vaccines basically aren't. Now, moving on to a quick update from Canada now. Now, we have the technology here. This is the overall picture in Canada here. So we see that the cases are probably levelling out to still going up slightly in Canada. Bit of a mixed picture though. Graphics are great these days, so we can see British Columbia, and that shows us the trend on the right. Alberta, Saskatchewan pretty high. Manitoba gone down nicely. Ontario down nicely. And Quebec lowish. So good to see very few cases in Nunavut as well, in largely indigenous areas. So much stuff on that Canada website. I'm not going to go through it all, but once you get onto it, you can spend quite a bit of time on it. It's pretty interesting. Now, Australia. So that's Canada. Just click on the link and peruse away. Australia, official government data. This is what we found useful in Australia to look at these cases here. So Australia overall, locally acquired cases in the last 24 hours. So the Capital Territories, there's been a few cases. Capital Territories really, of course, is geographically part of New South Wales, so it's not too surprising. Northern Territories, good. Queensland, well, there's still a few active cases, but only one new case. South Australia, none. Tasmania, none. Victoria, 127, and Western Australia, 0. So again, we're seeing really quite a compartmentalisation of Australia, with Victoria with cases, the Melbourne area, and New South Wales, kind of Sydney area, Canberra area in Capital Territories there, and the rest of Australia not too bad. But as we saw, the vaccination rate in Australia is still lowish, and if the Australians were to open the borders, then that would result in a lot of spread. So they're aware of this, and it's going to be a progressive reopening in Australia. If you want to go to Australia, you've got to wait till 80% are doubly vaccinated, which could be early next year, perhaps. We really don't know. Something like that. End of this year, early next year. Hopefully end of this year. Now, United States, the booster story is an interesting one. So United States booster doses. Mr. Biden, you'll be pleased to hear, qualifies for a booster dose, so he's getting his booster dose. May have had it by now. Over 65, of course. Now, Moderna and Johnson & Johnson. So Mr. Biden had 2 doses of Pfizer, so that's why he knows he's getting a booster. Now, the United States really does need to get its act together in informing people who've had 1 dose of Johnson & Johnson or 2 doses of Moderna. We do know that 2 doses of Johnson & Johnson are highly effective, but whether that has ended up being recommended, or whether they're going to recommend a Pfizer or Moderna for a booster dose for people with Johnson & Johnson, they do need one because their level of coverage is lowish with 1 dose. And what's going to happen with people who've had Moderna? They have to comment on that next week. It's going to be just a laughing stock if they don't comment on that by next week. And so far, the definition of fully vaccinated has not changed. So people who've had 2 vaccines are still counted as fully vaccinated. Now, there's a big fuss in the American media about Dr. Rochelle Walensky. They're saying that she's ignored the advice of her officials and has extended the vaccine remit. Well, we anticipated this 3 or 4 days ago. It was obviously going to happen. We knew it was going to happen 3 or 4 days ago. She's extended the vaccination to, as well as the vulnerable and the over 65, to occupational groups, grocery workers, healthcare workers. I think some teachers, or a lot of teachers as well, who can qualify for a boosted dose. So nothing surprising there. The press did seem to make a bit of a meal of it. But just to look at the United States here. So here we see this is the cases, daily cases. So we do see a bit of a reduction there. It's a definite reduction, and it's been sustained, which is good news. But as we know, the deaths are not yet following. Deaths remain high in the United States, unfortunately, but that will improve shortly. That line there, the deaths line, will follow this line here. We'll follow the cases line. It's just a case of how long it takes. And of course, the deaths are largely in people that are unvaccinated, unfortunately, in the States. because there's still about 85 million people unvaccinated who are eligible. So what's this one? This is trends in the number of vaccinations. Oh, this is interesting. Yeah, so this is vaccinations for all of the United States. And the data that is good is so good. You can look at a state and you can see how that state compares to the average. So there's Iowa, for example. And we see that this is the national average and Iowa has been well behind. Iowa is the red line. And even with the boost, even with the stimulus of the Delta variant, still very poor uptake here in Iowa compared to the national average in grey, which is much higher. Or maybe look at one more example. Oh, what should we choose? Texas. That's what's happening in Texas. Well, again, we see Texas has been, well, certainly here consistently below the national average. And only just sort of limped up to the national average really during the Delta surge. So go on to that if you're prepared to risk being stuck there for about half an hour, because it is really quite addictive. And this one on the CDC tracker, of course, is the hospitalizations. Now, this is going down, which is encouraging. And I was particularly encouraged. I did have a browse around this before. If we look at some of the states where hospitalizations were high, they are starting to go down now. Still at a high level, so that's actually Virginia still going up there, but I think that's a bit of an exception, fortunately. Let's have a look at where should we look? Let's have a look at Mississippi. There you go. Oh, look, that's a nice drop in Mississippi, but still, this is the previous peak over last winter, and still high. I mean, it's gone down, which is great, but it's still high. So, hospital services, no two ways about it, still stretched in the United States, and I assume the situation is just the same as here in the UK, where we've got this backlog of patients, which is really quite a problem. This collateral damage. So, all the links are there. Do have a look. Let's have a look at some trends in the UK before we look at the vaccine hesitancy issue in the UK. So here we have the United Kingdom. So these are this is the vaccination status, which we know about. So yeah, it's looking good, but we are slightly behind some other countries. Cases in the UK, though, in terms of people testing positive, well, the line just speaks for itself, doesn't it? Going up slightly at the moment. Deaths in the United Kingdom, well, they're still not insignificant, to be quite honest. I mean, they're nothing like as high as last winter, of course, but here we had nearly 1,800 people dying a day there. So it's still, we're still at, still reasonable amounts of people dying. 164 there on the 18th of September, for example. So not insignificant. And in terms of hospitalisations in the UK, they're the admissions, they're the people actually in hospital. So that data tells it's going down, but very gradual reduction. Now, that's what I want to look at here. 5 million people over 16 have not had one dose. Some people are described as committed vaccine opponents who'll probably never get one. They often believe in conspiracy theories, like it causes impotence or disorder of the testes, or other conspiracy theories, or it contains microchips and other nonsense, things like that. But I've actually tried talking to some of these people, and they actually, it's not funny really. It's tragic. I mean, you try and give some arguments to them, and they actually, a couple of times people have become quite aggressive with me. Not physically aggressive, but shouting at me and stuff, and it's strange. You can't argue with a delusion. It's delusion is a fixed belief, isn't it? Not amenable to rational argument or debate, and not held by the others of the same race, creed, and religion. So it's sort of, you'll have your own opinions on that. But anyway, these people are never going to change their mind. Some have genuine safety concerns, which can often be discussed with education, although young men, for example, the risk is real for inflammatory conditions from messenger RNA vaccines, for example, although it's smaller than getting the disease, usually. Some people distrust institutions, which I can understand, to be fair, but There we are. Some people are sceptical or indifferent. It's like in Germany, they put up a lot of regional centres and gave away free hamburgers or hot dogs or whatever they eat. So made it though more convenient for those that just couldn't be bothered. So South Tyneside Council did a survey on this. Younger men from deprived areas are most likely not to get vaccinated. Now, these are the wards in the UK are council areas, ranked by deprivation and makeup. So these are the poorer areas here as we go down. So 1 is the poorest area, 9 is the most affluent area, and this is for men. So we do see that there's kind of a trend line there. If we did a sort of a best fit line on that, just to be pretty crude about it, but we do see a kind of correlation line there. So men, particularly younger men from more deprived areas, less likely to get vaccinated. More affluent areas, much more likely to get vaccinated. In women, the trend is there as well, but it's not as steep. So again, women in poorer areas, somewhat less likely to get vaccinated. And again, I think we can definitely draw a trend line there. I don't think there's any question about that. But not as marked difference as men. Now, why should this be? Now, I am not a sociologist, but why should it be that people in more deprived areas, basically lower income areas, are less likely to get vaccinated? Tell me. I'm not really sure why that is the case. Tell me. I don't know. Why should people in affluent areas be more likely to get vaccinated than people at poorer areas? Let me know. I'm not a sociologist, fortunately. The other thing that's surprising, I don't particularly like doing data in terms of ethnicity, but this is reported by the BBC, so I'm going to cover it. Now, these are the age groups. So in the over 80s, for example, whites are 98% vaccinated in the UK, South Asians 89%, mixed 84%, others 84%, black population, people self-identify as black, 78%. And it's the same in that age group, and it's the same in that age group. Why would that be? So 74% of people that self-identify as black between the ages of 65 and 69 have been vaccinated, opposed to 95% of people who identify as white. Again, why should this be? And younger age groups, it's even more. So again, the black population, 71%, 70%, 68% in the 50 to 54. Now, younger age groups, it's even worse. This is the trend in younger age groups. So we see that young black men, only 40. So in other words, 60% of young black men have not been vaccinated. Now, why? Why would ethnicity? Well, I mean, everyone's British, everyone's living in Britain, so I'm not sure ethnicity is a factor. Why would skin pigmentation be a factor in vaccine uptake? I really don't know. I'm struggling on this one. Let me know. Let me know. So, triggers. How can we encourage people? Remind people of the common good. Some people respond to that. Protecting grandparents or parents, protecting vulnerable people. Social responsibility at work, for example. And some just can't be bothered. So, like in Germany, who said they gave free hot dogs, and that's made quite a big difference. And being in convenient centres. What seems to be a big motivating factor in the UK is people not being able to go on holiday. So there you go. I mean, but when we combine this sort of, let's just look at that graphic again, just to finish today. I mean, when we combine the hesitancy or people being motivated by a hot dog to people that are desperate to get the vaccine in poorer countries, it is rather a point for reflection, really. So there we go. I think I'll leave that for today. There's more to say, but before I go, I know a lot of people have just started watching the channel in the last few months. So if that's you, then you might not know about the book. So these are the textbooks I've written. There's that one, the physiology notes. That's all about normal body function with lots of pictures. And then there's this one, pathology notes, pathophysiology notes on all the disease processes. Now, These took me about 3 years each of my spare time to write. I wrote that one first, and then I wrote that one on diseases. But we wanted to be able to distribute them globally to people who could, and we have largely distributed these in Africa and Asian countries. But we're now doing it on PDF. So since we put this on PDF, completely free download, so people in poorer countries can get it. But if you're in a richer country, you can get it free as well. You can download it all as PDF, and you can use it in teaching notes, or you can just read it out of interest. So it covers all the systems of the body and all the disease, all the major disease processes. It's like the basic foundational knowledge for proper understanding of healthcare. So the PDF, I'm going to put the link there. Download the PDF, put it on your phone. There's a mobile phone friendly version that's being extensively used in Africa now, which is really quite gratifying. And then there's a normal PDF version for PCs and laptops and printing out and things like that. So do feel free to freely download those PDFs. And thank you for watching.